transform patient care. As the best trained, most experienced, and highly skilled of the cadre of staff most teaching hospitals, senior specialists and consultants constitute the topmost experts who could be said to be the working solutions and intellectual banks in the provision of specialized clinical services, training and research in the health sector of any country. Nana Chairman, it's in the light of this that all leading tertiary healthcare institutions make conscious efforts to put in place governance mechanisms that actively tap the input of senior specialists and consultants to guide the formulation of operational policies and institutional strategies for the delivery of quality clinical care services. Regrettably, KATH over the years has failed to optimize the use of this rich human resource through the lack of formal fora, such as we are witnessing today, to deliberately consult, engage, and involve this large group of senior specialists and consultants in the design of strategies towards the effective attainment of its mandate. This state of affairs has over the years resulted in the emergence of a gulf between management and this cadre of staff, a situation which has weakened the hospital's ability to reach its fullest potentials due to the huge underutilization of this highly prized human resource. This forum is therefore being organized as part of the drive to bridge any gap, real or perceived, between management and this group of staff, acknowledge their indispensability and contributions to the realization of the hospital's mandate, and actively seek their expert inputs and participation in improving patient care, training, and research at the hospital. Nana Chairman, distinguished ladies and gentlemen, senior specialists and consultants are the creme de la creme of the staff of any tertiary health facility, as they bear considerable responsibility for the provision of leadership and mentorship required in the expert management of complex medical cases and other subspecialist clinical services and training. It is therefore in the strategic interest of management to create a formal platform for regular engagements with them for the purposes of promoting a culture of consensus building, inclusive decision-making, and collective commitment to the continuous improvement in tertiary healthcare services in the hospital. This Maiden Forum would hopefully mark a new chapter in the contemporary history of this hospital and enhance its operational resilience through the generation of ideas critical to the optimization of its capacity to deliver high quality but cost-effective subspecialist care to patients. Nana Chairman, distinguished ladies and gentlemen, another expectation is also that this forum, the first of its kind in the history of the hospital, will help us to make amends for past omissions and rekindle our love and commitment in making KATH a far better and preferred facility for thousands of clients. For the overwhelming majority of us, we are doctors because of the significant role this hospital played in our training, career, and position as prominent medical professionals in this country and beyond. We owe it as a duty to make this hospital far better and responsive to the needs of its clients for world-class clinical services, training, and research. The forum, being held under the theme, Driving a Customer-Centric Healthcare Delivery at KATH, the role of senior specialists and consultants, is meant to be uncensored. We have met here for direct, substantive, and dispassionate exchanges aimed at building bridges and forming consensus. As a board and management, we are here to listen to you on how we can all help to transform this hospital into a top-notch medical institution. The three topics that have been outlined for engagements today are only meant to provide a structure for our deliberations. The format for this forum may not be perfect, but we believe it is the first right steps to take in the drive to build a new KATH that meets and even exceeds the expectations of its clients. Nana Chairman, distinguished ladies and gentlemen, before I bring my address to a close, the assurance I want to give you is that this forum will not be a talking shop. Management will pursue with religious commitment the constitution of the requisite action plans that will see to the full implementation of all the propositions and decisions that will be generated by the end of the day.